Aaron, thanks for getting closer to one of the biggest races of the year, the Cooper River Bridge Run, of course, coming up on April 2nd. Thousands of runners going to lace up their sneaks and embark on one of the most breathtaking 10Ks you'll find anywhere in the country. Here to tell us how to make sure that we're properly prepared before race day is Dr. Jeffrey Armstrong with Roper St. Francis. Doctor, thank you so much for being here. We do appreciate it.
Thank you.
Well, let's talk about this thing. I did it once, and I couldn't walk for about 5 days afterwards. So what do you need to do right now to get in shape for this bridge run?
Well, it's getting a little late at this point to get in shape for
That's why I'm not running.
Definitely. But basically, people who have been preparing are starting to taper down now and get ready for the run and follow their normal training course. I think what a lot of people do inappropriately is they do wait too long to begin their training, and that leads to a poor performance as well as potential injuries.
See, I always hear the stories about people I see the next day go, yeah, I didn't train for it. I ran it in about an hour and 15 minutes. That's really not recommended medically standpoint.
That's not the best way to approach the bridge run.
No, it's not. You brought some shoes around here right now. If people want to get a new pair of shoes, is it a good idea to do that now that the bridge run is just about a week out?
It's really too late at this point to purchase new shoes.
Yeah, that's Blister City right there.
That's right. You really don't have a time to transition into them and get them properly broken in. It could definitely lead to some minor injuries.
What do you need to look for, though, when you are buying running shoes? Let's say after this one, you're going to retire those sneakers because you set your best personal time. You need a new pair of sneaks. What do you need to look for?
Well, basically, sneakers are made so differently nowadays, and there's some that are controlled, there's some that are cushioned, there's stability ones. So you need to know what your foot type is and what to look for because everybody's foot type is different. Also, you know, the same shoe size that you wore 3 years ago has changed. Each brand now, the size can be slightly different. So you really need to be aware and get your foot measured when you do go to the store.
That's a smart tip, of course. What kind of injuries do you guys see post-race like this? Is it a lot of knee things, ankle things, a lot of swelling?
It's mostly overuse type of injuries, you know, strain and inflammation of tendons and tissue that's associated mostly around the lower extremity is where you're going to see most of your discomfort.
And stretching, of course, is such a big part of running, both before a race and after. A lot of people don't heed that advice. It's one of the most crucial things you can do to stay healthy.
It really is. I mean, everybody should implement a stretching and strengthening program into their training because strengthening provides stability because if the muscles aren't strengthened, then they fatigue and that can lead to injury as well.
A lot of people say, you know, I'm just going to push through this pain. At what point, if you're running this race or just training, do you need to say, this is a little bit too much, I need to stop what I'm doing?
Well, really, any type of pain is an indicator of some type of injury, and it really needs to be addressed. Pushing through it is not the best method because you can actually exacerbate that condition, which could then result in a poor performance during your race and prolonged recovery time.
And of course, hydration, so important race day.
Very important. Post-race as well.
And those carbohydrates before. Doctor, thank you so much for being here. We do appreciate it. Great tips right there. And we'll be right back with more. Stay with us.